Hey, Mira Web guests, I'm back again with the second installment related to medication and drugs. So I've got James Thompson loaded, going down to the bottom of his record, and you can see medication and drug lists there. And we learned last time how to add, how to delete, and how to edit drugs by clicking on this link. This time I want to consider why you, as a counselor who does not script drugs, would even be would want to care about drugs. There's a couple of reasons. I just clicked on this link here. You can photocopy this or print it. Give this to your client and have them take an inventory of all the drugs that they use so that you can put them all in this system. Now, the reason that you want to record drugs is because drugs have side effects, and one of them, not really a side effect, but a serious issue here with alprazolam, Xanax, is that the potential for addiction is extremely high. Well, who's going to monitor whether or not this person is abusing this drug? Now, you have to be very careful as a counselor. I know some people are not careful. They're risking litigation. But you have to be very careful about what you say about drugs. You have to realize that the person that is sitting with you in this office is very much open to suggestions. They very much lean on what you say. And if you even insinuate that a drug is something they shouldn't be taking, there's a good possibility they're going to cut it off. And I've had clients who are on Prozac, have been on Prozac for 2 years, who just cut it off after I talked to them one time. Don't even know what I said, but they'll come back and they'll say, I really thought about that drug that we talked about last time, and I quit taking it. Well, Prozac's not something to just bail off of. You have to taper off of this, or it can cause some really serious issues. You are not responsible for scripting the drug that the person is taking. You may not, under penalty of probably being sued, maybe even criminal liabilities, you may not suggest to a person that, the drug you're taking, you probably shouldn't be taking. I hate that drug. You shouldn't use that. All that kind of stuff. You're looking to open a door to litigation. Don't do that. There's enough real trouble out there that you can get in without opening this trouble that doesn't need to be opened. You should have access to this person's doctor by phone if you need it. Now, they have to give you express permission to allow you to do that. You can't just call the doctor, even if you got the doctor's name. No, the doctor can't call the doctor. This person has to say, you have my permission in writing to contact the doctor. Why would you want to contact a doctor? Well, let's go down here to alprazolam. Let's look at this. Number one, the addictive potential is extremely high. First of all, every time I come in contact with a person who is taking a drug that is suspect like this, of causing a problem, I ask for permission to talk to the doctor. I call the doctor. The doctors are usually appreciative that you call them. And you can, if you get permission from the client to do it, you can just come right out and ask the doctor, what do you want to know? When do you want to know it? And the doctor may say, I hesitated giving him this, but he really seems strung out, so I gave him the Xanax. Could you please watch and make sure he doesn't abuse it? I have had clients bring in their drug book so that I could count pills. You got 90 of these for 30 days, and 60 of them are gone in 10 days. Now, that's not a good thing. Somebody's using too much of this drug. If I have the open communication and the permission of the client, I'm going to call the doctor and I'm going to say, use 60 in 10 days. Use 6 a day here. And the doctor's going to say, okay, well, we're all done with that. It's one of the reasons that you want to stay in contact, or one of the reasons that you want to record drugs. Another one is side effects. You're on the front lines here. You're seeing this person once a week, once every other week, twice a week maybe. The doctor's not seeing them after they give out this drug. Now, interesting thing, and I don't know if it's in here. Let's see it in side effects. Overdose is a serious possibility with this drug. If a person just bails off this drug, it can cause seizures. Again, it's such a fine line. You don't script this drug. You don't tell them when to start, when to stop. But when a person comes in and says, you know, I kicked that, I quit it, I dumped it, I forgot it, I threw it in the toilet. Okay, well, one of the problems here is right here. Risk of seizure from side effects. That is especially possible when a person just quits. So this person comes in and says, you know, I just dumped all my Xanax. I know I was using too much, so I threw it all the toilet. Well, you know, you may have a seizure. And you may have to tell the person, yeah, that wasn't a good idea. That could cause a seizure. Just watch out. If something happens, I need to know. Your doctor needs to know. But that's a problem. One of the side effects, I didn't put it in here, one of the side effects of pretty heavy use, maybe abuse, okay, I guess we can cross that line and say abuse, of Xanax is that it's an extremely rapid drug. In fast, out fast. High peak, short period of time. On the downside, when a person is coming off of it, one of the things that it causes is anxiety and panic attacks as you are coming off. That's one of the reasons people abuse it, because when they start to get that anxiety feeling, that panic feeling, they're going to want to bail off, or they're going to want to take more. I'm going to take more of this, get rid of this. Anxiety and panic disorder is the reason you take this drug. One of the side effects of this drug when you're coming off of it is anxiety and panic disorder. So you're going to want to be able to tell the client about all these issues. Here, this one right here. Do not eat grapefruit or drink grapefruit juice while using this medicine. Did the doctor tell them that? Did the pharmacist tell them that? Do not use alcohol while taking this medication. Triples or quadruples the effect of the medication. They could go into respiratory distress. Again, you could go up here to File and to Print. You can print this. Talk it over with the client, highlight some stuff that they may want to know. And this is true with every single drug in here. You're going to get this kind of a report. As a person who's watching over this client, I think it's so important for you on the front lines to know what they're taking, what interacts with what else, what causes psychological problems. There are some drugs that cause psychological problems. Here you are trying to treat depression. The person's taking Lexapro. Lexapro can increase suicidal thinking. Well, they're taking to get rid of depression, and here they're feeling more suicidal. You have the tools in front of you to say, oh, you know, this person's feeling suicidal. I wonder if it could be the drug. Maybe I need to get their permission and talk to their doctor. So That's the philosophy that we have about drugs, or that I have about drugs here, the Merit Web Project, and you need to consider recording every drug that a person is taking.